Isn't it so annoying when you search for the best healthcare jobs and you keep getting the same answers? Physician assistant, physical therapist, or nurse. What about those lesser known jobs that 1. Give you job satisfaction from a positive impact on patient care, 2. Earn a decent income while doing so? For those of you looking to enter the industry, searching for these niche jobs can take time and effort. Let's explore the role of Epic EHR analysts and how much they make. Stick around to find out. Health IT analysts are in high demand. They play a vital role in healthcare organizations responsible for maintaining and improving the Epic electronic health record. Considering a healthcare IT career, you may wonder how much Epic EHR analysts make. Here in this video, we'll take a closer look at salaries based on Epic modules, years of experience, and location. But do be sure to smash that red subscribe button and like the video first. Before discussing the salaries, let's first explore what Epic analysts are and other Epic jobs to better understand their roles. What are Epic analysts and their type? Most people have heard of Epic, the electronic health record software used by healthcare providers, but not everyone knows that a whole team of professionals work behind the scenes to ensure that the software runs smoothly. There are three main types of Epic roles: developers, implementation specialists, and trainers. Each type has its own unique set of responsibilities. Let's dive in to see what those are. Epic developers are responsible for creating customizations and enhancements to the software. This might involve writing code or creating new features. Epic developers have a background in computer science or software engineering. According to Glassdoor, they make a salary of $151,000. Epic implementation specialists are responsible for installing and configuring the software at healthcare facilities. This includes working with the IT department to ensure that the system meets the needs of the hospital or clinic. These specialists have a clinical, IT, or project management background with training and certification directly from Epic headquarters. They earn an average salary of $80,000 to $95,000 per year, but significantly more depending on their role. Epic trainers are responsible for teaching hospital staff how to use the software. This includes conducting training sessions and creating instructional materials. Epic trainers typically have a background in education or instructional design. They make an average salary of around $83,000 per year. According to ZipRecruiter, Epic principal trainers can make $147,000. Now let's discuss the salaries based on the various Epic modules. Salaries based on modules. An Epic module is a logical separation of the EHR product. It's separated by the type of function it performs or by the service line. For example, with service lines, for radiology, there's Radiant. For cardiology, there's Cupid. For lab, there's Beaker. For function, there's MyChart for the patient portal or Prelude for ADT. There are several modules in Epic, and salary for these analysts can vary from region to region. However, some of the most commonly used modules include the following. Epic Ambulatory. The Epic Ambulatory module allows clinicians to enter notes within the patient record and view results. Physicians can place orders for laboratory tests, medications, and other diagnostic procedures. Being the main component module of Epic, ambulatory analysts are in high demand, and certified analysts can earn an average of $95,000 per year once they've attained certification in it. Epic Cadence. This module allows staff to schedule appointments for patients. Appointment scheduling is one of the most commonly used modules in Epic, and certified professionals can expect to earn an average salary of $105,000 annually. Epic Tapestry. Billing modules are used to submit insurance claims and process payments. The billing module allows providers to submit claims electronically and track the status of those claims. Tapestry analysts get an average salary of $112,000 annually as per ZipRecruiter. Epic Preload. This module manages patient admission, transfer, and discharge. Prelude allows providers to view patient demographics and insurance information. On Glassdoor, the average salary is around $52,000 annually in the States. Now let's look at some salary examples of other modules with many jobs opening these days. Epic Bridges. The Bridges analyst can earn around $147,487 annually. Analysts will need to be versed in HL7. Epic Radiant. Radiant analysts can make an average salary of $131,638. Successful analysts should have a background in Radiology Information Systems or PACS. Epic ASAP. The ASAP analyst can generate $142,200. These analysts should have a thorough understanding of the workflows in the emergency room to perform well. How much do Epic EHR analysts make based on state? The state and city you choose to work in can greatly impact your salary. Different regions of the country can pay you differently as an Epic analyst. Nebraska. Nebraska is the top paying state for Epic analysts. The average salary can fall anywhere between $133,000 to $154,000 annually. California. Next comes California. As an Epic analyst here, you can make an average of $130,000 to $150,000. Washington. Washington is the third highest paid state in the United States. The average salary here is around $149,000. Massachusetts. Massachusetts comes next with an average income of $144,000 paid to the Epic analysts here. New York. New York City pays an average of around $115,000 to Epic analysts. However, your module and work experience will better decide your pay scale. Colorado. Colorado also falls in one of the highest paid states in the United States with an average salary of $105,000 per year. How much do Epic EHR analysts make based on years of experience? Like any other profession, your salary as an Epic analyst will increase with each year of experience. Here, we'll discuss the salaries you get as a beginner and will gradually move upwards to 10 plus years of experience. 0 to 2 years of experience. For newly certified analysts, when you freshly start as a beginner with no experience, you can expect an average salary of $52,000 to $65,000 a year. It can be based on the Epic module you're certified in, prior IT or clinical experience, or job location. 3 to 5 years of experience. Similarly, as you get experience of 3 to 5 years, you say goodbye to the beginner level and enter an intermediate designation with an average salary of around $65,000 to $85,000. You might even demand more if you have the right skill set. 6 to 8 years of experience. Epic analysts with 6 to 8 years of experience are called experts and get an average salary of around $105,000 to $125,000. 9 plus years of experience. Epic analysts with 9 plus years of experience can easily earn between $135,000 to $155,000 without working 40 hours a week. Some analysts leave their steady 9 to 5 jobs to become consultants. As an independent consultant, you can charge as high or as low as you want. You can increase or decrease your working hours as per your needs. Consultants can bill between $80 to $100 per hour. Epic is a great job to have if you're lucky enough to be certified. It's important to note that one cannot attend a college class or self-study to become certified. Certification comes directly from Epic HQ, and one must be employed directly by Epic or sponsored by a healthcare institution to attend training at Epic. Check out our playlist to find out how you can potentially get certified in Epic. As you can see, there's a lot of variation in the salaries of Epic EHR analysts. The module you choose, the state you work in, and your years of experience will all affect how much you make. However, one thing is certain. A career in healthcare IT can be very rewarding financially and professionally. Subscribe to the channel and like the video if you found it helpful.
Like, subscribe, and comment below if you want to see more of this type of content.